Hi, good evening everybody. I'm Michael Glynn, work for Solihull Council. So here today to talk to you, I suppose, from a slightly different perspective to some of the other speakers this evening. But really just to tell you a little bit about what we've been doing with Telecare and assistive technology in Solihull in the last few years, and maybe what we've learned from some of that. First thing we've learned is not to call it Telecare and assistive technology because people don't understand that. It doesn't mean anything. So hence, useful gadgets is our sort of is our preferred term, really, particularly when we're talking to the public. Just in terms of kind of context of what we're talking about, I mean, some of the devices have already been spoken about this evening in terms of Telecare assisted technology. This is just, hopefully you can see that, this is just part of a leaflet that we use, and it just shows some of the probably most popular, most commonly used forms of Telecare. Some of them mentioned before, so falls detection, bed occupancy sensor, enuresis sensors, also things like movement detectors, smoke detectors which are linked also. So the idea of the Telecare is that it's linked directly via a telephone line to a 24-hour service that sits behind it, so that if there is an alert or an alarm, that a response can be coordinated. So when we talk about Telecare specifically, I suppose that's what we're talking about. But we also use a wider variety of gadgets too, and some of those very sort of low level, cheap, easy to use. So the Magi plug is just a device to sit in a bath or a sink, and when the water builds up, the pressure builds up, and it releases the plug, so it lets the water out. So it's just a very simple way of preventing floods. That's one of the I suppose the more sort of basic things that we use. Some of this extends through to other aspects of design as well. So induction hobs, we've included there. Induction hobs are great for people who may not be aware of, hot surfaces and other cookers that stay hot for a long time, or that will just have a gas flame or something. So an induction hob can be a really good way of promoting safety for people. It's not particularly Telecare, but it's just a useful device. So there's a very wide range of devices that we're talking about. Okay, so just what I was planning to do today really just have a little tour through the process that we've been on in the past few years in Solihull. So we did an external evaluation in 2012 of our existing Telecare service, because we knew that it wasn't working very well and we wanted to develop it further. And what we found was probably not uncommon. I'm certainly aware of several other councils in the West Midlands area at the time who were doing similar things and with similar results, really. So what we found out, there was a very low take-up of Telecare. We had very low awareness of the technology and its benefits, and that was both within the council, so from our own staff, but also in amongst the public. And unfortunately, national research shows that's still the case. There's some work done by Carers UK in the last couple of years which found that recognition for Telecare assisted technology is very, very low among the general public. We found that we had a cumbersome, difficult process, so that wasn't helping us. We at the time didn't have any dedicated staff who were working on this, so it's very much a sideline. We were very poor at our recording of Telecare. We were achieving very low levels of savings, if any savings at all. And I suppose the headline for us was that we weren't using the potential of this technology in anything like the way that we could be. So what did we do? We set up a project to address this. So I'm the project lead, so I was appointed. We appointed a Telecare officer, so an operational lead, so an occupational therapist with a special interest in this area, and also over a period of time two assistants to join her. We ran it as a transformation project because we were in the process of doing quite a lot of work around transforming adult social care, so it fitted in well there. It's now become a project of our integrated care programme in Solihull. Part of this work was developing a service specification and going through a procurement exercise. We wanted to appoint a partner to work with who would be sourcing the equipment, who would be maintaining it, and would be handling the sort of service aspect of running a telecare service. Did quite a lot of staff training. I say quite a lot. We did masses of staff training, and it's an ongoing process. One of the kind of key aspects of our project. We also did a lot of redesign work on our process and on our recording as well. So that's been very important for us. And another really important thing for us has been the performance dashboard. So on a monthly basis, we produce performance dashboards so we really understand exactly what it is that we're doing and what we're achieving, we hope. So the wider strategy, I suppose, that supports the project is our ambition has been to make the use of telecare mainstream within adult social care. That's the overriding objective. But we've also wanted to place this within our wider service offer to our public. And so in many respects that's based around self-help, that's based around supporting people to be independent for longer, not doing things for people. It's also around promoting independence and reablement, so it's around helping people to metaphorically get back on their feet if they've had a fall or a period in hospital, etc. Also within our personal budgets process, so we're as a council very much involved in providing personal budgets to people that have adult social care needs, and we needed Telecare to sit within that model, and that links back to the whole idea of personalisation, and for us one of the things that we've realised very early on in this process is that you can't do this generically. It needs to be personalised, it needs to be based around the individual and the assessment of their needs and their circumstances. So personalisation has been very important for us. It's also been important that we use a wide range of equipment, so we don't just use equipment from a single manufacturer, a single provider. We use a whole range of equipment. We'd also wanted to start simple, and I'm quoting somebody who's in the room, which is always a dangerous thing to do, but my colleague Jim there coined the phrase Poundland to broadband, and I think really it's just that idea that we use a very wide range of equipment. We use some items which you can get on the high street very inexpensively, so i.e. Poundland and other stores, right through to some fairly expensive bespoke equipment that we use for people with a high level of need. So it's trying to get that range and use that range appropriately. Latterly, of course, the other big thing in local government has been around the Care Act, so it's been really important that the work that we're doing supports that. But I guess in terms of good practice, we'd like to think that we've been meeting the aims of the Care Act for some time, or at least trying to. We've seen that. In terms of performance, I suppose just sort of headlines for us. There is an efficiency agenda for us as a council as well. Obviously, we're charged with using taxpayers' money in the best possible way, in the most efficient ways, and as you'll all be aware, we've faced some fairly significant cuts in our budgets in recent years, so that emphasis has been even more important. So sitting behind our business model, if you like, around using more telecare, there's been a financial model which is effectively based on the idea that if we're using telecare well with individuals, that we can save money. That's largely based around avoiding future costs. So if we can support people earlier, if we can support people better, then we should avoid the need to have to commission or provide more intensive services. So obviously trying to move away from the residential care, trying to move away from daycare as models of provision, more towards personal budgets and people having more choice and control over the services that they receive. So our model is based around the number of installations that we do. It's also based around average savings that we can make, and there's a whole piece of work that sits behind that to calculate those savings, and it's also around how long that saving might apply for. So just in terms of those installations, just a couple of figures there. So since November 2013, we've installed around about 850 items of Telecare to just over 400 users, so unique users. And from that, we have been able to generate some savings. So last year, the savings generated were about 130,000. Also, adding in there at the bottom, not as an afterthought, but the quality of life benefits, because of course when we're using Telecare assisted technology, it is about making things better, making things easier for people, keeping people more independent, and of course that comes with a huge range of benefits both to them but also to their carers and loved ones. And part of what we've been doing over the past few years is building up a range of case studies really based on our experience locally, using a very wide range of equipment, but really being able to demonstrate what the benefits have been, and we find that those are some of the most powerful things. So when we're talking about training and awareness raising locally, those case studies are probably the most powerful tool that we've got to do that. That's just a pie chart showing the kind of equipment that we're using currently. I don't know how well people can see that. The most popular item that we're using at the moment is the falls detector. So wrist wall falls detectors primarily, the single biggest item that we're installing. The second biggest chunk of the pie is for pill dispensers, so automatic medication dispensers. And sort of going down, we've got things like bed and chair sensors, smoke detectors, and then we're moving into sort of memory aids and door exit sensors, things like this. So it's just a bit of a flavour of the type of equipment that we are using currently. I think also just wanted to, I suppose, share some lessons learned from our perspective as well. I think one of the most significant things for us as a council has been around culture change. What we've been asking our social workers, occupational therapists and others to do has represented quite a change to their practice in terms of how they support people. The assessment side hasn't changed, but it's around how you best support people. So some of that has been at times quite a difficult journey, and it hasn't always been something that people have embraced with open arms. But what we have done is made some really significant progress there. I wouldn't say that everybody working for the council is necessarily a champion for Telecare and assisted technology, but what we do have now is a group of staff who have had some really good training. Their awareness has really increased, and they've been able to see not just the concept of the technology, but how it actually works, and been able to start using it themselves. And what we do find is that once somebody makes a referral and starts using Telecare, we find that you then get several more coming on the heels of it. So it's not really about the people that worker is working with. It's more about their confidence and their knowledge in terms of the equipment they're using. I think another thing that has been important for us has been the strong partnership we've got with our service provider. Our service provider is our local arm's length management organisation for housing, Solihull Community Housing. So that's actually an organisation which has a very similar set of values and objectives as we do at the council. So we've had been able to work through any issues we've had in terms of the service provision with them, and we've been able to learn together, which I think has been really important for us. I think we've also learned a lot about the importance of marketing this direct to the public. So I mentioned some of the barriers that we've had internally, probably about promoting this technology, but I think also as an industry, it is dominated by suppliers who like to sell to large organisations, so like local councils, housing organisations, etc., rather than sell direct to the public. And that's certainly something that we speak to manufacturers about, and our model for providing social care isn't it isn't what it was a few years ago. We're changing a lot within local government, and we need providers, manufacturers to change too. So, we, for example, as a council, we don't really buy the technology ourselves. It's our service provider who buys the technology. But actually, it's all about the individuals making that decision. So, whether they're people who receive personal budgets, so they're our clients, they're eligible for our services, or it's the even larger number of people out there who are self-funders, who are perhaps people who don't yet meet our funding criteria. The growth here and the development here is really around how that's marketed to those people, and importantly their carers. So that last point really for me is around, who are we promoting this to, who are we selling this to in effect, and very often that's carers, family members, for people as much as it is for the individual themselves. So that's another important lesson that we've learned, and that we're trying to go forward with and improve the way that we communicate. That's me. Thanks very much for listening.